Hello, fellow stroke warriors and families everywhere. We're welcoming you to another session of our physical therapy interviews. Today, my guest is my own physical therapist, Dr. David Seck. He's with Spark Rehab and Wellness, right? I got that right?
You got it. Yep, you got it.
Here in Bend, Oregon. He is a certified stroke rehab specialist and a Parkinson certified as well. Um, let's start with I didn't understand when I had that I was having my stroke. For awareness, please tell our listeners what is stroke, types of symptoms, and signs to be aware of.
Sure thing. Yeah. So basically, a stroke is there can be different types of ways it occurs, but it's a vascular incident that occurs in your brain. Um, and we can talk about the different types shortly, but it affects blood flow and oxygenation to your healthy brain tissue. And when there is an issue with that, you can, depending on where those that's occurring in your brain, you can come down with different signs and symptoms. So the mnemonic that the medical system and healthcare system uses is be fast. So signs and symptoms, as I'm sure some people are aware, are B for balance. It can start to impact your balance if there's a sudden change there. E is for eyes. So you might have some sort of visual disturbances start to occur. Um, F is for face. So sometimes you'll see facial drooping or asymmetry, depending on where the stroke might be located. Let's see, A is for arm. So oftentimes it impacts one half of your body. We talked about facial droop, but it can be hard to lift an arm or move a leg. So the A is for arm. S is for speech. It can be hard to articulate. When it impacts half your body, that's also your tongue and your lips, which you need for articulation. But that can also be word finding. It can be understanding other people's words. So that sort of confusion can occur there. And then the T is for time. So that's just the most important thing when you're possibly experiencing these symptoms is time is of the essence. You have to get in to emergency services as fast as you can because as this is occurring, the longer time uh, passes, potentially the more severe and significant these symptoms and outcomes can be. So there's different treatments that are sort of time sensitive that can prevent the severity of damage done by the stroke.
Is so the be fast, do you have to have all those symptoms or just one or two or?
That's a great question. No, even one of them that's a big abnormal change can be um, indicative of something occurring, of a stroke occurring, and it all depends on where in your brain that is occurring. So some people might, have more of the motor symptoms. Some people might have visual changes. Some may experience significant, balance disruptions. So you don't have to have all of them. Even one of them is cause enough to go find emergency
Part of the
services.
reason you call the ambulance is because you're put first in line, correct?
Yeah, I've heard different things, but I think if you call for an ambulance and you're experiencing those symptoms, especially when you're on the phone, I actually experienced this recently and say, "Hey, I think this person is having a stroke." They'll know that this is important. We're coming out. We're gonna get you to the hospital as quick as possible.
Sounds great. What's the most common effects of a stroke?
Yeah, so it does depend on where that stroke occurred. So, oftentimes we think of stroke looking and presenting similarly, and there's more common presentations and then there's less common ones. So the most common ones that you might see are people who are impacted on half of their body. Um, and that's because how our nervous system works in our on our brain, our motor cortex controls our right side controls the left side of the body for the most part, and the left side controls the right side of the body. So typically, depending on the distribution, the blood supply that's being impacted in the brain tissue, you see these sort of hemi effects, and so you'll hear hemiparesis or hemi um, paretic, and that means that half of the body is impacted. So you might see people have weakness on one side. You might they might have something called spasticity or tone, which is um, their resting muscle state might have some more activation than they would like. Um, or they might have, if you quickly stretch a muscle, they might have a quick contraction. That's spasticity. In addition to that, it's common to have sensory changes, so numbness, even pain that you feel. That's not necessarily a mechanical issue. It's because of the central nervous system. You're going to find proprioceptive deficits, and that's just a fancy word for knowing where your joint is and how much weight is on it. So sensory information that our joints give you. Um, and so those are all fairly common. And as a result, you can lose strength, you can lose range of motion in your joints. And certainly it can impact your vision, which impacts balance. It can impact your awareness of a whole side of your body, or even your ability to know if something is safe and judge where you are in space.
Okay.
Um, so those are some of the common ones. There are a lot of others, but that's what you'll oftentimes see.
Isn't it true though that all strokes are different to a certain extent?
Yeah, absolutely. There's certain vasculature in your brain that makes you have more common areas that have stroke occur, and you'll hear different types of stroke. So you'll hear an MCA stroke or a pica stroke, and that refers to the blood supply that is either being blocked or has had a hemorrhagic issue. And I know we haven't talked about that
Yeah.
those types, so I'm happy to delve into that if needed. But yeah, it just depends on the location.
And I think most of our listeners know what kind of stroke they've had to a certain extent. I didn't know, I didn't realize that I had a blood clot in my brainstem, and I didn't
Mm.
realize till just a year or two ago that that's called an ischemic, right?
Yep.
Okay.
Yeah. So you have ischemic strokes or embolic strokes, and that's basically either a narrowing of the arterial blood supply, which kind of has a blockage, and that can be from cholesterol buildup and things along those lines. Embolic stroke is going to be something that detaches and then blocks the rest of the blood supply. Um,
Let's get into the actual physical therapy part of it. What um, can a physical therapist help, and or what does the physical therapist do?
yeah, that's a great question. So, um, physical therapists are basically movement specialists. So they will have someone come in, they'll take a look at how they move and where there might be deficits in that movement, so movement errors. And they'll talk to someone and hear what they're having trouble with, and what they want to get back to, and do some assessments based on that to determine what is the cause of these movement errors. Why is someone having difficulty accomplishing what they either used to be doing or want to be doing? And so we'll take a look at things like range of motion. Do you have the proper movement in your joints to perform a certain task? We'll take a look at strength. You have the muscle power and ability to send that signal down, to those muscle groups. We look at coordination, so not just ability to access those muscles, but can you control them in the way that you want? We do sensory testing to determine how that impacts balance and fine motor skills, because we rely on sensory feedback to know how we're performing a task. So when I pick something up, the sensation in my fingers tell me how hard I'm gripping it. And that's going to be very different if it's a big glass, like a heavy thing where you need a strong grip, or if it's something really delicate that you need to hold in a certain grip where if you apply too much pressure, you might damage that. Um,
Right.
we take a look at all of those things and synthesize it into how it impacts movement. And then from there, we assist people with their deficits, whether it's motor control, strength, range of motion, balance, etc.
I just, within the last couple of years, since I started seeing you, actually, um, I didn't realize that there was, I just lost my train of thought again. Anyway, I didn't realize there was a difference in physical therapists. Would you explain that?
Yeah, I think, just like any physician, there are specialties within the physical therapy realm and profession. So, for instance, I have my board certification in neurologic physical therapy, which means that I specialize in disorders of the nervous system, and that can be central nervous system, so brain and spinal cord, or peripheral nervous system, as the nerves travel further out into the body. And so the approaches, the treatments, the assessments are very specific to that type of physical therapy. And there's orthopedic specialists, there's sports specialists, pediatric specialists, vestibular specialists. So we all kind of have our niche and specialty. And the nervous system is just very different than an orthopedic injury, which is typically a tissue issue, where we're working to drive neuroplasticity, improve your motor control, functioning of your body, so that you can walk and do the things that you want to do. That's impacted by your nervous system, as opposed to a sore hip or something along those lines.
Right.
Yeah.
What are the qualifications a patient, would a stroke patient in particular, would look for in a physical therapist?
Yeah, that's a great question. So I think the setting is important. You'll want to make sure it's at a setting that is equipped to assist people who have neurologic injuries, and in this case stroke. Someone, you certainly don't need these qualifications, but I mentioned, if you want to look for someone who has a board certification in that specialty in neurologic um, physical therapy. And there's a lot of other certifications you can get there for stroke. There, you can become a certified stroke rehab specialist, a CSRS. So that's something that you can look out for. And certainly just knowing, what a PT's background and experience is, what settings they've worked in, those will all help guide you to the right physical therapist.
And these days, most physical therapists have their doctorates, right? Or are required, aren't they?
Yeah, I think it's a requirement now. We've been moving towards that probably over the last 15 years pretty strongly. So every program, every new graduate graduates with a doctorate in physical therapy now.
Okay. What about the PT facility? Do you object to people coming and checking out the facility before they start coming with you?
No, I think that's a great idea. We have people come to her all the time because you want to make sure that the equipment, the space, everything sort of meets your needs and expectations, or you can ask questions about it when you go and take a look, to make sure that you're going to the right place. And so I highly encourage that, and calling and asking what the facility has to deal with certain impairments, and what the experience of the therapists are with certain conditions. I think those are all important things.
At your facility, Spark Rehab, you also do Parkinson's and concussions and those kind of things. Are they within the realm of the, shall I say, stroke symptoms?
They can be. So those are also disorders of the central nervous system. We see all sort of neurologic conditions. Parkinson's, for instance, impacts a very specific and particular part of the brain. So, there's certain medications and treatment interventions that help with those certain movement disorders. Whereas someone with a stroke might not necessarily present like that, but they could have a stroke in your basal ganglia, which is where a lot of Parkinson's pathology occurs from. So
Oh, okay.
there can certainly be similarities, but there's also oftentimes, in terms of symptoms and physical deficits, big differences. And then the same thing, with something like concussion. You can have a traumatic brain injury that impacts a very similar location to someone with a stroke. So they can look very familiar, but something like a concussion is more of a diffuse injury throughout the whole brain, and those symptoms can, you can have similar ones of balance issues, vestibular deficits, headaches, but they can also look different and do need a different approach and have different interventions as well.
One of the things that has always impressed me about your growth at Spark Rehab was that you have occupational therapy, you have speech pathologist, you have the physical therapy. I mean, what I found that therapies are part of a team. What does that look like to you?
Yeah, I mean it's so nice to being in the neuro PT world to have a team, because for the most part, people who've had these life-changing neurologic diagnoses and events um, don't require just one member of the team. They require their primary care. They require their neurologist. They might have a massager, acupuncturist on their team, and having occupational therapy and speech therapy and physical therapy, all in the same place where you can communicate and collaborate is super important, because someone's plan of care incorporates so many similar deficits. If someone's having trouble folding laundry, for instance,
Mm.
a physical therapist can work on, the balance portion of it, the carrying and lifting and walking portion of it. The occupational therapist might work on more of like the fine motor skills required to fold laundry and place them down, or the reach. And then, the speech therapist is going to work on, okay, what's the sequence? Let's talk about the sequence that we're going to do it in, and make sure you're doing it correctly, efficiently, from a cognitive standpoint. So that one task requires collaboration from the whole team. And so having that is very helpful, and I think ultimately good for any patient plan of care.
I asked that question because I was so impressed when I was there yesterday, and four of them, your four therapists, were all talking about one patient. It was
Yeah,
just really impressive.
yeah,
So,
absolutely.
first steps that you take with a new patient. Is it more common to focus on walking and balance first, or strengthening? I mean, what are the steps and what determines that?
Great question. Ultimately, it comes down to just a few things. What are the patient's goals? So that's the first thing you ask them. What are they having difficulty with? If they're having just difficulty getting out of their wheelchair into their bed and back, or getting up from bed, sitting up from bed, or transferring to the toilet, those are the things that we'll work on first. The very basics. What does it take for you to be independent? Um, and
They
everyone's
call
going to
that
come in
ADLs, right? Average.
ADLs, yeah, and everyone's going to come in at a different point. Some people will be ready for higher level balance and mobility training right off the bat. And some people, we're just trying to wake up, legs to be able to transfer, or assist with, propulsion in a wheelchair. So it ultimately comes down to what the patient is having difficulty with and what their goals are. And that's going to kind of drive your treatment plan.
I was told early on that in my recovery, this would be as good as it gets. What do you think about that statement and why?
Well, it's kind of like nails on a chalkboard to most neuro PTs. Um, Healthcare is sequestered a little bit. So you'll have your ICU docs, your emergency room docs, you'll have your inpatient rehab docs. And oftentimes, they'll tell someone, and it's good to have realistic expectations, how much it might impact them, but they don't always follow those patients through their whole plan of care. And it's
Huh?
been cool. In my career, I've been in the, acute side, the inpatient side, home health, and outpatient. So I get to see this span. And I can't even tell you how many times I've seen someone who had a stroke or some other neurologic issue, 5, 6 years ago, that has made tremendous progress. It all comes down to having a goal and having a plan to achieve that goal. The way our nervous systems work is they constantly adapt to new situations. So if you set up your environment to ask your body to do certain things and do it repetitiously and use the principles of neuroplasticity, you're going to see improvement with that task. And I can't emphasize enough that I've seen remarkable accomplishments years and years and years after someone has had a stroke. It used to be sort of a myth, and to a certain extent, there's truth in that. A lot of your initial improvements happen in that 3 to 6 months, and then from that 6 to 12 months. Um, but we've learned so much more about neuroplasticity and how the brain can continue to adapt and learn new skills that it's a myth now. Your
Yeah,
recovery is not done at a year, and that's I think when you tell people that is sort of a self-fulfilling prophecy. If you stop working on these things because you think that's as much as you can be done, then that's absolutely as much progress as someone's going to make.
yeah. We've been batting around the phrase, you can choose to be a stroke survivor or a stroke warrior. Uh, I mean,
Yeah,
if you don't put in the work, you're not going to recover no matter how long it is.
it's a continuous process. It's not a journey that has an end date. And just like anything else, if you continue to work on it and continue to make it a part of your um, journey, then you're going to see those improvements.
Isn't it true that you're going to gain more functions if most people just go to their physical therapy once in a week and that's all they do. Isn't
Mhm.
it true that they should be taking home exercises, that they should be getting assignments from their PT to do home exercise as well?
Absolutely. You should have an extensive home exercise program. You should set things up. So, for instance, if you have difficulty using your hand and it's difficult to open up or manipulate, or it's not as strong, you should be putting an oven mitt on that other hand and making it, work on things for a little while every day, because uh, neuroplasticity requires repetition, it requires intensity, and it requires a ton of work. So when we're small, when we're babies and we're trying to learn how to walk or crawl, the amount of repetitions that you have to do till you learn that is huge. It's astronomical. It's so many repetitions. And so when you try to apply that to relearning how to walk or take a step, if you only get 100 attempts at that a day, you're not getting as many kind of built-in repetitions as you need. And especially if that's only a couple times a week, when you get to outpatient. So if you can set your environment up so that you're trying to do that every single day, you're going to have a much better outcome.
I said early on too, you shouldn't be doing this by yourself at home either, should you?
Well, some of the exercises we always try to set up so that people can do some independently, because the reality is you might not always have help. Now, we're not going to give you certain exercises that would put, if balance is an issue, for instance, that would put that person at risk for falling or something that's unsafe to do. So definitely, ask your PT if a certain exercise is appropriate, because the last thing you need is another fall and an injury. But we should set it up so that you can get as many of those repetitions in as independently as possible. So if you're in a wheelchair, what can you do to work on, strengthening and stretching and range of motion, so that when you get to PT, you can hop on a treadmill in a harness and we can push you, push you, push you. We don't have to spend time working on those other things. So that's all part of the home exercise program, and it should be set up so you can do as much as you can independently, but you also might need assistance. And safety is obviously, one of the most important things.
And obviously, you talk to your physical therapist about those programs, right?
Yes, definitely.
Um, there's, I've heard a couple times from different people the difference of task-oriented and functional training.
Yeah.
What's that look like?
Yeah. So task specificity is very important. When we are doing a certain task, it requires some precursors that you need to accomplish to do that. So um, you can work on strength, say in your legs, in your quadriceps and your glutes by getting on a leg press, and that's a great way to build strength. But you also need to apply that. So if you have not just strength issues, but you have range of motion issues and you have sensory issues, it's not just strength that's going to prevent you from picking up your backpack from the floor. It's going to be putting all that together. It's going to be coordinating it. It's going to be the balance of it. Do you have the range of motion? So when you're doing something that's task specific or function based, you're working on all of those, and we can modify the task, the intervention, to mimic what you're doing at home, to get sort of all of those pieces and not just, approach it from, we're going to work on your strengthening. We're tying it all together. And that takes a lot. Some people might even have the strength to do something, but they can't put it together when they're, bending down to grab something, or they lose their balance. So that's why task specificity is so important.
Is it the same thing? Is there a different function for the strength part of it?
Yeah, I mean, the strength requires, when you're doing a task, control of that strength. Whereas if you're just doing the intervention, that might not necessarily, if you're just doing a leg press, that might not necessarily improve the task. So an example is, um, my wife has the ability she's got the coordination, the strength, the dexterity, the vision to tie a fly, right? But she's never learned how to do a task specific um, activity that teaches her to actually how to do it. So,
Oh,
so she might have all the ability and precursors, but if she hasn't learned the sequencing, when to pull through, when to pinch, then she's not going to be able to do that task. So we look at something and say, what about this task is difficult? How can we bring it all together to help you actually do what you want to do?
there's some, well, the mental health aspect of stroke recovery. Um, and there's some going through those tasks, there's going to be a heck of a lot of discouragement. How do you get your patients to not give up?
So a couple of things. The first thing that comes to mind is you have to celebrate the small wins. Every little small thing that you do that's an improvement, you can't take that for granted. And you have to recognize that. As someone who's had a stroke, it's a lot harder to, because you're living with it every day. So you might see these small incremental improvements, but as a therapist, or PT, speech, you get to see these kind of improvements week by week. You get to do tests to tell where someone's at. And I think bringing that to someone's attention is super important. So I think you're, as a PT, you have to show those improvements, whether it's the small things. Hey, you can stand up and grab something from this cabinet now. That's amazing. Um, and you have to show with your outcome measures, your tests, you walked 100 feet last time, now you walk 200 feet. That's you doubled your distance.
Well, even walking 10 more steps than you did last week. It took me a while to realize getting up out of bed was my first victory that day.
Absolutely. It's the small things that count. And one of the funny things, like for a lot of my guys that I see, is the first time they pee standing up. It's a huge accomplishment. I've seen more grown men, get emotional over that and it might sound small, but it's not. It's huge.
Yeah, it is.
And so I think you have to celebrate those small victories. And then as a PT, we have to, in terms of motor control and the task we're asking someone to do, I'm not going to ask someone who can barely stand to get on a tightrope and walk, balance, right? That's going to set them up for success. It's not going to reward them. They're going to be discouraged by it. So when you're choosing an intervention, you have to have it be challenging. If it's easy, then it's not improving anything, right? If you're
Uh,
just standing with a wide base of support, you're not improving your balance. Your nervous system isn't adapting. It has to be very challenging. And there has to be some failure with that, which can be discouraging, but that should be communicated. Hey, I'm not going to ask you to do anything easy. There'd be no point. That we're not going to learn how to do something you already know. We're going to do something that you're going to struggle with and have some failure. But what's important is we're looking for XYZ improvement, or we're looking for your ability to do it a little bit better next time. And that's how you improve. And I think if that's communicated by the therapist, then you have that mutual trust and understanding of this is going to be hard, but this is going to get you better. It's not going to be
yeah.
easy. Otherwise, we wouldn't be doing it. And you might feel more accomplished, but you're ultimately not going to reach your goals if it's too easy.
Well, and I consider me dealing with Spark Rehab, and it's like I think a majority of my best recovery is because I ask all the questions.
Mhm.
It has to be a two-way street. And
Yep.
to me, the only dumb question is the one you don't ask.
Yeah, absolutely. Yeah.
I'm noticing there's a lot new electronic-based tools for physical therapy. Could
Mhm.
you describe some of those? And is it functioning or is it just designer stuff that's just not there yet?
Well, it depends. It's such a broad category, right? So you
Yeah.
can take something like virtual reality, and there's been some really great breakthroughs in virtual reality in how your brain processes, certain inputs, visual inputs, etc. Um, and there is some efficacy in that. Um, Anytime you look at anything, it all comes down to it's a tool and you still have to do the work. So there's electronic stimulation that you can use to assist and improve motor control. There are certain types of robotics that can assist you with movements. So, like, say for instance, I had just this amount of movement. Okay. There's certain robotics that they'll sense that movement and they will assist and do the rest of the movement you're shooting for. And then over time, as you start to do more, it backs off and it makes you work harder, right? And so you have to go further and further. And so there's types of biofeedback like that work really well. There's pieces of equipment that can assist you with things. There's fancy orthotics that help you actually change your walking and support you and embrace you. Um, and there's a million products out there, and they should be used as tools. If
Okay.
if you can use a game and go from maybe 10 repetitions a day of using this to I'm going to play this game for an hour and you get 1,000, that's driving neuroplasticity. So that's a great tool to improve your arm function. And I think there's some really cool applications of that sort of try to drive neuroplasticity based on the technology and the tools that are available.
I started with you guys in August of 22 with Dr. Shannon Compton, your partner. Um, and I guess one of the things that made such a huge difference in my recovery, for example, um, was the HydroWorks water treadmill. I mean, what's the concept behind those kind of things? The
Yeah, absolutely.
aquatic therapy.
So that is it's another tool, kind of like I was describing, that allows you to maybe more effectively reach your goals. And the HydroWorks is one of, aquatic therapy in general, and especially the HydroWorks treadmill is one of my favorites because it's an underwater treadmill. And so it does a couple of things. It off weights your body weight. So if you have any sort of pain through the joints, any issues with weight bearing that might be prohibitive, that's a great tool for off lifting how hard you have to work. So it allows you earlier on to work on certain things that might otherwise be really challenging. Um, it's got warm water, so if you have any sort of tone spasticity that makes it difficult to move on land, that warm water can actually relax that, so you might have some more available movement and active range of motion. The resistance of the water is really good to practice moving your arms. So there's a ton of benefits that something just like water can allow you to work on things that you might not be able to otherwise. And for instance, we have like an overhead harness that people can wear when they're learning to walk over ground or on the treadmill, that will allow you to be safe and secure, so that the physical therapist can help and move your legs or advance your legs, so you can work on early gait training in a way and get more repetitions than you might not be able to. So that's just another way of how we have different tools that help drive neuroplasticity, help drive intensity, and allow you to do things you might otherwise not be able to.
I'm going to brag because you guys got me on that. I mean, when Shannon first put me on that thing, I think she put me at a speed of 1.5, and I held on to those railings for dear life.
Yeah.
And then as you and I progressed through it after Shannon, I mean, what we get up to an 18-minute mile in the water?
Oh, maybe even faster than that. Yeah, I think you're going up to 5.5 or something. I mean, you were hauling
Yeah,
on there.
yeah. It does
And
work. It works for me anyway, you know.
yeah, well, it's a
Uh,
great way too, where, for orthopedic issues, if you have pain and just that impact through your joints and running, if that's prohibitive on a treadmill on land, that's a great way to work on that in the water too. So
is it suggested? I know a lot of people that do this. Is it also suggested that you just do walking in a pool? I
yeah, I
mean,
mean,
it's
if you can walk
basically,
in a pool or do any sort of aquatics, a lot of times it allows you to get ranges of motion that are difficult on land, and you're buoyant, you're supported, so it's gentle on the joints oftentimes. Aquatic therapy is fantastic, and it's good for sensory issues. To have kind of water, if you're having numbness or pain, it can be good for that. So yeah, having a aquatic therapy is in your tool bag and part of your plan is can be really effective.
what do you see the future of therapy looks like?
Yeah, I think we're learning more and more every year. There's tons of research coming out on what drives neuroplasticity, what drives improvements in motor control and function. Right, that's ultimately the goal, is to get someone back to doing what they want to do, moving how they want to. And I think you're going to see, whether it's technology like we've talked about that helps assist and improve on that. I think you're going to see um, more technology integrated into how people do things. And I think you're going to see, advances in medical science as well, that kind of allow us to, really help someone rehabilitate and return to as much normal function as they can. And so my hope is that future of therapy is even more rehabilitative and effective than it is now, because we're constantly learning and getting better technology.
you should be learning along with your physical therapist as well, right?
Oh, absolutely. I think if there's people that are motivated and they want to understand how things work, that helps them know why it's important to do what they do, and then that's motivating for folks. And I would say, as much as you can learn, you know, do, and then apply that and use that as a motivation. Yeah.
Put you on the spot a little bit. What do you wish your patients would have known early on that they didn't?
Well, typically it's just what they might be capable of. And I think a lot of people have uncertainty, and why would they know, so I think knowing what their potential is, and with hard work, where they could end up. I think that's usually one of the big ones. And then there's so many gaps, I think, in healthcare education, that people don't know what they don't know, and that's so tough, because it's specific to the person. But it's, hey, I might actually need to modify my home, but no one ever told me. Or this brace, I think, is going to really help you out, but no one ever told you. Or we can get you a custom wheelchair. You don't have to use that one, that someone gave you 5 years ago, that doesn't work for you. So I think, just in general, if there was better healthcare communication and advocacy for people who are unfamiliar with these diagnoses, I think that would make a huge difference. And that's part of the role of the entire healthcare team, but especially therapists, who get to spend a little more time with their patients.
Yeah. Anything you want to add today, David?
No, not, I don't think there's too much I would want to add, other than I would say, as a physical therapist, and I recently talked about this as well. My biggest message is to a patient who's had a stroke or some other issues: don't limit yourself. It Try things that are hard. Failure is okay, and it's the only way you're going to get better. And if you're motivated to do certain things, get back to a sport, get back to a hobby. It might look different, but you can find enjoyment, you can find fulfillment. And so think about those goals, ask your PT if that, is realistic, or how you can obtain them, and shoot for them. There's a path to, meaningful movement, and hobbies, and recreation, that anyone can have. And it's definitely the role of the PT to help assist them there. But that's my big message I would give to people.
Thank you, David. Dr. David Seck, DPT, NCS, CSRS, MSCS, CEIS. Wow, that's quite the background. With Spark Rehab and Wellness, how did they get a hold of you, David?
They can reach us at our website at sparkrehab.com. You'll find all the information of where we're at, where we're located. We've got, some frequently asked questions, insurance information on there, and our phone number. You can give us a call if you have any questions. We're happy to answer those.
Thank you for your time today, David.
You bet. Pleasure as always.
Take care.
Thanks.